Hello to our favorite audience. Welcome to the Ordained Radio TV Gospel Ministry, where we bring you the end time news, the undiluted word of God, dynamic praise, trending health fact and gist. And you are welcome back again on Fit and Fabulous, where we are starting another series on diabetes. The first episode we had was on the general overview, the causes, the symptoms, and we are progressing on this series. And of course, we have a guest speaker that will go further on this topic. I mean, your host, Ajayi Adenike, and it is with great pleasure I introduce to you Dr. Oladapo Adetunji.
Thank you so much. It's nice to be, here once more,
Yes.
following the medical series that we have been talking about. We had a very wonderful one on hypertension some time ago. Now we are talking about diabetes, and this is the second in the series.
Yes.
It's good to be here. Thank you so much.
Thank you so much for creating time, sir. So please stay with us, grab your pen, grab your book, and make sure you're writing something down because we are about to educate you, to enlighten you on diabetes. So we'll be looking at the WHO classification of diabetes, the medication and therapy, as well as the management. So sit back and stay with us in it. Thank you. So sir, let's go into the WHO classification of diabetes.
Now, diabetes is actually, before I go into that, just digress a little. Diabetes is actually of great concern for us here in Nigeria, and of course, being the most populous black nation in Africa, I'll say by extension to the whole of Africa. And the reason being that the staple food that we eat is majorly carbohydrate. We eat a lot of rice that at the end of the tunnel, it boils down to having a lot of glucose in our body, in our system. And statistics that we have been able to gather from us here says about 11.2 million of Nigerians are living with diabetes, which is actually very outrageous.
Wow.
With a projected prevalence of about 3.7%, meaning within the next 2, 3, 4 years, we're going to have an increase in that. And so diabetes is really of great concern. The WHO classification has three ways in which they classify diabetes. We have the classification based on normal diabetes, and then we have the classification that says, okay, this person is about to go into full-blown diabetes. And then we have someone that is classified as, being a diabetic patient.
Okay.
Yes. So those classifications look at the parameters are taken on two platforms. Either the person has not eaten at all, when you say, okay, a person that has not eaten and the diabetic profile is taken, they say the person falls below 5.6 millimoles per liter, and then we say, okay, fine, this person has a normal fasting blood glucose, blood sugar parameter. Now, when a person is still fasting and is classified as pre-diabetic, then it means the value is between 5.6 and 6.9 millimoles per liter, while a diabetic patient has something, above 7 millimoles per liter. We must also know that all these values that we are talking about, they are taken not just once, but technically it should be taken about twice within, a specified period of time before you pinpointed that, okay, this person can be classified as either normal, pre-diabetic or diabetic. And that's what the World Health Organization has prescribed for us.
Okay.
Yes. You see, your physician at all, all those parameters are important for them to take. And usually they ask you, when was the last time you ate? Because, intake of meals also affects the parameters or the data that is generated from the glucometer or whichever machine that is used, to access the glucose level of that particular patient we are talking about. And that's why we have what we call the postprandial data also, which means, okay, a person that has eaten 1 to 2 hours after a meal, the data is going to be a little bit higher than if the person has not eaten at all. Yes.
Okay. Let's go into the medications and therapy of diabetes.
Now, there are three major, medications. You have the ones that are taken orally, the ones that are inhaled, just like you have these inhalers by asthmatic patients and all of that, which we're going to be talking about later on in some other series. And then we have the injectables. Most of the time, the injectables, insulin are the ones that are used by most patients that are suffering from the type 1 diabetes that has been talked about extensively by you in the first series. So I'm going to encourage you to go ahead and watch that series where we classified the different types of diabetes that we have. So for the injectables, you could have what we call the rapid acting insulins that is injected into the patient. This one works for about 3 to 5 hours with an onset of about 1 hour. Then we have the short acting insulins, then we have the intermediate acting, and then the long acting, depending of course on the kind of situation that is ongoing within the patient, as determined by the physician or the healthcare worker that is managing that patient, because there are a lot of things to consider. And sometimes it could be very complex. So you really need a specialist to be able to manage a diabetic patient very well. For the oral, I talked about the injectables. For the oral ones, we have 4 major ways in which they are classified based on the way the medications work. So we have ones that stimulate the production of insulin, exemplified by what we call sulfonylureas. These are the glimepirides and the glycosides. Then we have one that are called insulin sensitizers, which rather don't actually enhance the release of insulin, but they rather enhance the response of the body's physiology towards insulin. Yes.
Okay.
And those are the biguanides, such as metformin. Then we have some medications that delay the absorption of glucose by the intestine. An example of that is ascaribos. Most of the time we don't usually have a lot of patients on that. Then a last class exemplified by what we call sitagliptin are the ones that increase glucose excretion in the urine, and as a way of that they reduce the glucose level in the body system. Yes.
Okay. So now, for instance, if for the injectable,
Yeah.
if we have a patient that's probably collapsed, or due to the patient is usually on insulin, but at that point in time the glucose level is too high.
Okay.
So the classes of injectables I mentioned will be the fast action.
Yeah, most of the time you might want to give that person a rapid action, but a rapid acting insulin that has an immediate activity.
Yes.
But one thing you must also know is that the patients themselves, which I'm going to talk about briefly as we go into the third phase of what we're talking about, the patient themselves must have a good understanding of their diabetic needs. And in some countries, they actually carry these things, are not something one should be ashamed of. And you say, okay, person is diabetic, and then it's as if it's a death sentence. It is not a death sentence once you're able to manage yourself very well. There are some people, they carry it about, with a small pouch on them. I am diabetic, this is the medication I use, just in case
of emergencies,
that we are talking about. So apart from that, I said the other time that when you are trying to determine the kind of medication you are going to use for a diabetic patient, it involves a lot of complexity, because you need to look at, okay, when this person eats, what is the glucose level that is achieved? You need to look at medications for that. What kind of profession does the person participate in? What is the person's job description? Because once you have a job description that uses up the glucose level that you have in your bloodstream, then and the person is diabetic, then you need to know the kind of medication to give to such an individual.
Okay. So now that means that to our audience, because you're diabetic does not mean that you can use the medication prescribed to another patient.
Definitely not.
You can't use, because you need to have been checked and know the kind of class that you belong to.
Exactly.
So that you know what kind of medication.
Exactly.
And they don't also stop. Some people, they will advise them to get the glucometer, and so that they could check at home. And once they say that, okay, my sugar level has gone down today, some will decide to stop. I want you to just give advice.
Yeah, now one major thing that I think that usually causes what we call hyperglycemia, we notice it in patients that are strictly, routinely, they make use of their insulins, or they make use of their oral anti-diabetic medications, but without actually checking, the profile of their state using the glucometer, as you mentioned. Such people usually end up having a very high level of glucose, because as you are even giving insulin, it should not be overgiven. You shouldn't, over-inject yourself. Most people that are on insulin, they are taught how to administer the insulin, themselves, home use and all of that, And at the same time, also, one major effect of not using your medication is hypoglycemia. So it has to be a very, very strict balance, and that's why whosoever is diabetic, the people that live with him or her and the
Yes.
caregivers must also have an understanding of the medication that the person is using. What works for A does not necessarily mean it's going to work for B. There are some that they are just placed on orals. There are some that are just placed on injectables, and they're fine. They use the injectables and they're fine. In fact, for the injectables, you have some that are mixed, pre-mixed insulin injections, and then some that are not even pre-mixed. They use the long acting in the morning, support it with the immediate acting during the day, things like that. So it's a different ball game for each individual.
Okay. Yeah. So before we go into the management very quickly, if you are watching us live right now, you can also listen in on our radio website at www.ordainradiotv.com.ng, and also please follow us on our social media, on our Facebook, on our YouTube at Ordained Radio TV. Invite your friends, your family, everyone around you. Invite them to be a part of our community, so they can also learn and get value. So, very quickly, let's go to the management of diabetes.
Now, the medication therapy management of diabetic aims at three major things: to optimize the medication regimen for the patient, to improve the outcome of the patient, and to enhance the quality of life of the patient. Now, a person that is diabetic, has so many do's and don'ts. Of course, the role of a good nutritionist or dietitian cannot be overemphasized when you're managing diabetes. So it's actually a holistic view. You have a pharmacy, you have the physician, you have the nurses, you have the dietitians or the nutritionist, as the case may be, managing the person. The quality of life of the person has to be enhanced. And that's why one major thing that medication therapy management does is to ensure that the patient has a very sound education about what diabetes is. Okay? Sound education about what diabetes is, what he or she should eat, and then in case there's hyper or hypoglycemia, in which case the person could become confused, blurry vision and all that. All those symptoms are things that medication therapy management are expected to teach, such a patient that, look, once you start having these symptoms, that definitely you need to pop in maybe candy or pop in 2 cubes of sugar so that your glucose level will rise a little until you can get to where you can actually do the testing and then know if it's time for you to take your medication or not. So the key aspects of medication therapy management includes, just as I said, medication optimization, addressing any drug-related problems. Most of the time, there's something we call comorbidities, whereby a person that has diabetes is also, treating some other things. In most cases, we've had studies that link, a lot of diabetic patients are also hypertensive, or hypertensive patients are diabetic, and then, they have some other things they are using. And one thing we always tell people, whatever medication you want to use, make sure it is approved, by a medication expert, your physician, your pharmacist, as the case may be, before you start popping them. Because in Africa, we do a lot of carbon copy and rank zeros, so to say.
Exactly.
What works for me is this. I mean, I had this symptom, my friend used this, definitely I'm going to use it. It does not work that way at all. So we must address drug-related problems. And then I talked about patient education and support. Support from family, support from co-workers. A person that is diabetic is not a life, it's not a death sentence, but it's just for the people, within the vicinity of such a person to know that, okay, this particular person is diabetic. So what do we do in case there's crisis? So patient education and even caregiver education is important. Then collaboration and effective communication. Even though you are a health expert, how are you able to communicate effectively with the patient that you are treating, with the patient that you are managing with respect to diabetes? Have you been able to tell the person, okay, you are suffering from type 1 diabetes, your body system is attacking your pancreas, or you are suffering from type 2 diabetes, this is the problem, you are producing glucose that your body is not enhancing. The patient has got to know, and then there has to be monitoring and follow-up. Follow-up in the sense that we have, members of the healthcare team that are positioned to find out, okay, the last time my patient came, this and this were the readings. How have you been taking your medications? have you been routinely taking your medications, and then have you been sticking to taking your medication? So those are things you want to emphasize, and more importantly, enhancing the quality of life of the patient. You want to make sure that the overall quality of life of the individual is enhanced. Tell the person diabetes is not a death sentence. It can be effectively managed. We have people, and we have a lot of research and statistical data to prove that people that live with diabetes, they live excellent and very good quality of life. They have very good quality of life. So those are examples of way in which medication therapy management helps in diabetic situations.
Thank you very much, sir. And I want to put it to our audience, if you have any questions relating to all that we've discussed today, please drop them in the comment section. We'll attend to them in the next episode. Thank you so much, sir, for creating time.
It's always a pleasure to be here.
Yes, and let's just leave it to our audience to digest and get their feedback. Please give us your feedback on what you have listened to today. If you have any questions, like I said earlier, please drop them in the comments below. And that will be it for today. Please take into consideration all that we have mentioned. Please make sure you get your glucose level checked all the time. And if you have not checked it at all, please, this is a directive now, so please go check it now. So thank you so much for staying with us till this time. We appreciate your support, and we appreciate all your comments, your like, and your shares. Please, we look forward to more, and till we meet again next time. I'm your host, Ajayi Adenike. Bye for now.
Bye.